Hey y'all, today we're going to take a look at deafness and hard of hearing. And as I'm sure you are aware after seeing her video, my daughter Abby falls under this category of hard of hearing. So this one's personal for me. Now, in IDEA, there are different types of hearing loss. First off, there's deafness. And this is a hearing impairment that is so severe that the child is impaired processing linguistic information through hearing with, or here's the important part, without application that adversely affects a child's educational performance. So this is a child that even with a hearing aid, it doesn't matter if they have the hearing aid in or out, that the impairment is so severe that they can't process linguistic information. There's part one. And as always, there's a part two. Adversely affects the child's education performance. Then you have the idea of what's called a hearing impairment. And this is, sometimes it could be permanent, sometimes fluctuating, that adversely affects a child's educational performance, but it doesn't fall underneath the definition of deafness. This is what Abby is, and we'll talk about these categories in a little bit. So how hearing loss is evaluated. And I know you've already watched that video on how the ear works, and it's so remarkable to me the way God created us. It's just awesome. And when we talk about hearing, we talk about things like frequency, how high or low a sound is, or intensity, how loud or quiet a sound is. We've got specialists in hearing called audiologists, and they're going to use an audiometer to determine the frequency and intensities a person can hear. And this is how they actually identify hearing loss. The first type you have is called an air conduction. And these, and some of you might have had this before, earphones are used to produce pure tone sounds. And if you've ever done that before, you've got the headphones on and you've got to raise your hand on the side that you hear the sound on. And then there's also what's called a bone conduction method. And this is a vibrator is placed on the forehead, so sound bypasses the outer ear and middle ear and goes directly into the inner ear. It's another way to gauge hearing. So when we talk about hearing loss, there's different ways this can occur. The first is what's called conductive hearing loss, and this is where the sound waves cannot travel to the inner ear. And then we have what's called sensory neural hearing loss. This is damage to the inner ear, those tiny hair cells that you saw in the video, or even to the auditory nerve. Then you can have what's called a mix, and this is a combination of both conductive and sensory neural hearing loss. And then you also have the last one's called audio-neuropathy spectrum disorder, and this means that sounds cannot be understood by the brain. So when we talk about hearing loss, it's categorized according to the degree of severity. How bad is the hearing loss? When you have a person with mild hearing loss, it's 21 to 40 decibels. And they have typical hearing, except for speech that is soft or far away. They'll have trouble. Then we move to what's called moderate hearing loss, and this is 41 to 55 decibels. And they can hear typical conversation speech, but it's very hard for them to follow the speech. Then we move to what's called moderately severe hearing loss, and this is where my daughter Abby is, and this is ranging 56 to 70 decibels, and only loud speech can be heard. We move to severe, which is 71 to 90, and even here, loud speech is hard to understand. We hit profound when it's greater than 91 decibels, and only assistive listening devices enable the individual to understand speech. So it's also categorized according to when the hearing loss started to occur. Congenital means it occurs at or before birth. When we have adventitious hearing loss, this is something that's going to occur after birth. But we have prelingual deafness. This occurs before a child has learned how to speak and understand language. So they have lost their hearing before they can speak and understand the language. And then we have postlingual deafness. And this occurs after a child has already learned how to speak and understand language. So conductive hearing loss is very common. 80% of some students in elementary school will have conductive hearing loss. Usually it's going to be temporary. If any of you have ever had an ear infection or ruptured an eardrum, you're looking at conductive hearing loss. It's a temporary. For long-term hearing loss, it can usually be corrected with hearing aid surgery or other medical techniques. Sensory neurohearing loss, on the other hand, it's usually caused by hereditary and genetics. Disease can cause this, and then you have what's called noise-induced hearing loss. And hearing aids can help in this category, but it doesn't completely fix it. So the question is, how much does a person actually hear? We use the term residual hearing. Sorry, can't get my words out today. And this is the amount of functional hearing a person has. And it influences the accommodations that a student may need in a classroom. When we talk about a student that is hard of hearing, information can be processed from sounds, but they're usually helped with the hearing aid. So this would be my daughter, Abby. Deafness, on the other hand, limited sounds can be perceived, but hearing is not the primary means of gaining information. Here, the primary means is usually in terms of ASL, American Sign Language. So how many students are there that this happens? This is what's called a low incidence, low prevalence. About 1% of students with disabilities will receive services for deafness or hearing impairments. Many of the students with hearing impairments have additional disabilities in their service under those categories. And as you know, Abby also has dyslexia and dysgraphia, so she's serviced under specific learning disorder, but they also have her getting services under her hearing impairment. So receiving their education, 60% of these students spend most of the day in their regular ed classroom. This is particularly common with students with mild to moderate hearing loss. Only 9% of students attend a separate school. And this is more common though when we're talking about deaf students. And at these schools, they'll use American Sign Language because they can more easily engage in their classes, extracurricular activities. They have peer groups who can understand and communicate them. So there are challenges that occur from hearing loss. Difficulties comprehending sounds in the environment, understanding speech, engaging in oral communication, restricted ability to communicate, difficulty developing oral speech because they're not hearing the sounds, so they don't know how they should formulate those sounds. Low academic achievement in reading because there is a correlation between the sounds you hear and the sounds you read. Difficulty gaining information through lectures. Well, if they have difficulty hearing, it's going to make it harder for them to get the information and struggle to be fit in and included in classrooms. So we can lessen these challenges by having early intervention and identification. The use of cochlear implants and hearing aids are paramount to helping these students. Those who are prelingual speech therapy and even postlingual, that even though they've already developed it, assists with that. Visual supports to go along with the words you're saying. Special seating arrangements, the use of American Sign Language or assistive technology or accommodations in the classroom are all going to be helpful for these students. So if you've got a student with mild hearing loss in your classroom, it's going to be really hard for them to listen carefully and take notes and process information. This could be, I'm thinking about my daughter Abby again. Abby reads lips and she reads lips very well. And if she's watching a lecture, reading your lips to gain the information, as soon as she looks down to her paper to write those notes down, she's no longer reading your lips. And so, it's really hard for them to do that. And in a noisy classroom, students with hearing loss, even only slight, can miss 10% of what a teacher says, and those with mild may miss 50%. When COVID was going on and everybody was masked, Abby, who never misses assignment, was missing assignments left and right. And we started talking to her and her service providers at the school, and it turns out that teachers at the end of class, we make adjustments to homework assignments and say, okay, we didn't get to this, or we finished up this, let's do this assignment. And teachers were changing assignment dates and assignment parameters at the end of class. Students are up and moving around, so it's hard to hear. Abby can't read lips because of their masks and their voices are muffled. And so we had to add in there provisions that all assignments now had to be in writing to Abby. So just the noise in the classroom even without masks, can cause issues. So accommodations, use of visual aids, having pictures, charts, graphic organizers are going to be fabulous in helping these students. Have a peer note taker so they can read your lips, watch what you're doing during the lecture, and follow along with your words while somebody else is taking the notes. Preferential seating, so you're sitting near these students. Having people who are signing ASL, as you saw in one of the videos this week. And then assistive listening devices. I got to see this in action in the classroom the other day. The teacher had an FM transmission device, what she said, around her neck, and she would turn it on when she was talking, and the student had a small receiver in her ear, so she was constantly hearing the teacher's voice above all others. Now, how do you detect hearing loss? Most states have universal screening for infants, and these hearing impairments, though, can develop later. Abby's didn't develop until she was about 6 months old. And looking back, these warning signs are now triggers that I see, but I didn't understand it then. So reacting to visual things, not sound. The fact that these individuals, they won't begin speaking by the normal 12-month mark. When they do speak, their sounds are going to be unclear or unintelligible. They'll have difficulty following directions. They're going to speak too loudly or have the TV or music volume all the way up because they feel that's the only way they can hear. So teachers and students, when you have students who are deaf and hard of hearing in your classroom, first and foremost, maintain those high standards for the students. They can achieve success. Speak slowly and clearly, but not loud and exaggerated. Face the class when speaking so they can see your lips, see your face. Repeat important information. Reduce background noise if you can, and arrange the seats in a U shape for class discussion so students can hear one another. Assign a peer buddy or a note taker to help them, and ask the student's family or the student themselves, what can I do to better serve you? What can I do to help you? Now, there are communication options. Maybe your student, as you saw in some of the videos, uses American Sign Language so you could have an interpreter in your classroom. The student might be like Abby and reading lips and getting a lot of information that way. Sometimes we do what's called cued speech, where you use hand signals to help the students to read your lips. And then there's total communication. It uses things like oral and finger spelling. And if you've ever been a high school girl, you know the finger spelling because that's how you talk back and forth to your friends during class. So when it comes to post-secondary options, post-secondary schools are designed primarily for that are designed for students who are deaf, are already going to have programs of supports in the place for these students. Most colleges and universities, though, do provide accommodations such as note takers, interpreting services, listening devices to go in and helping these students to begin with. So there's different types of hearing aids. You have what's called behind the ear. And what this is a plastic case that sits behind the ear. There's a tube that comes down through that, and then the amplification piece is going to be in the ear itself. And sound travels through the air and the mold and into the ear. Then you have an in-ear, and these are plastic devices that sit completely in the ear itself. So usually they're about no bigger than the size of your pinky, and you may not even see them sometimes in students. So it depends on the student what they're going to need. Abby uses a behind the ear because her issue is caused from holes in her eardrums, and so there's always fluid in her ear, and you don't want electronics where there's fluid, so her electronics sit on the behind the ear piece. Then there's also something called a cochlear implant that is available as well, and this video is embedded for you online as well. And this is a surgically implanted device that sends electrical signals directly to that auditory nerve, and this is really helpful for those who have the sensory neural hearing loss, and it's going to require therapy through an audiologist to learn how to interpret those sounds that you are hearing. And now the deaf community, some people like them, some don't, because remember when we talked about people first language, the deaf community sees themselves and their deafness as part of who they are. And so that's a defining characteristic and something that eliminates that component. Not all of them see as beneficial.